Hello guys, today we discuss about the most important dairy disease. It is called mastitis. Mastitis is the inflammation of udder. Everybody knows it, but it is the most critical dairy farming disease, which is uh, very much potent to suffer the dairy industry. A lot of people who are encouraged to do dairy farms and we make a big invest to for a day for dairy cows. And then the dairy cows are become affected with mastitis, and their hopes are damaged. So first of all, how mastitis spread, we have to learn that mastitis is affected organ, which is udder. Udder has four teats, and those teats are vulnerable to the environment. So you have to consider the teat entry point in which the bacteria, virus, fungus, molds, mycobacteria can enter and make it prone to mastitis and let the milk stop. So first of all, the most vulnerable parts are the teat orifice. So when the cow after milking, the farmer should give the cow the ad libitum grass so that it becomes stand up for 30 minutes, and it becomes eat on the feed and grasses, so that the teat orifice will be closed after 30 minutes. And if it is stand up, the teat orifice should not be touched with the floor. The floor is the most important site where the mastitis happens, and all the bacteria business. Suppose that E. coli, the coliform bacteria, is in environmental mastitis, and it is the most common, and also the fast forming bacteria Streptococcus staphylococcus, which enters through the teat orifice. So first of all, if you want to cure from mastitis, treat the floor well. If you don't treat the floor well, you can get rid of mastitis. So we should use different types of detergents, washing powders, which bleaching powder. But everybody has keep in mind that the floor should be keep in touch with the disinfectant at least 10 to 20 minutes. Every disinfectant has its working time, so it should get contact with the floor. And the floor treatment is the must be necessary to control the mastitis. So if mastitis happens, then what to do? So first of all, should check the temperature. What is the temperature? In case of acute mastitis, it will be hot, swollen udder. Then first you should do the spray cold water in the udder, and choice Ampicilin or Amoxicillin, gentamicin. And if it is high fever and painful and hot swollen, and so you should select Tolfenamic acid and give some sort of probiotics in alternate time of this antibiotic, and also promethazine hydrochloride. It also helps to reduce the mastitis problem, acute mastitis problem. And if the udder is cold and hard, so this type of mastitis is happen when it is chronic mastitis. And that type of time, you choose antibiotic amoxicillin, ampicillin, or gentamicin, and choose dexamethasone to reduce and subside the inflammation of the bacteria, and also choose the different types of probiotics and also promethazine. Most commonly use this, and should be course at least 5 days, otherwise it will not work well. But still, it cannot be cured or not cured, depends on the management system. So other types of mastitis, if it is leaking, blood leaking from the udder, so you should, that type of mastitis is caused from Leptospirosis. So you should give oxytetracycline anti-mammary infusion to control this. Uh, but first of all, after calving, the udder become swollen, but don't confuse with udder edema and mastitis. In case of udder edema, the udder will be soft, and in case of hard swollen hard mastitis, the udder become hard. So if the udder become hard, you should treat with mastitis treatment. And if the udder becomes soft and milk is coming, so you can choose amino acid, Frusemide, and vitamin D3, and also other check powder, like some sort of companies keep in the market, other check powder or some probiotics, prebiotics. That's it. If the udder has laceration and abnormal abscess, you should treat with amoxicillin and use iodine or povidone iodine in the udder. So each all sort of management should be done to treat the floor, and keep the teeth in the dipping in the povidone iodine, and like the povidone iodine mixed with the water in the cup. All the teeth should be dipped before milking and after milking, so that this will not be get touched to the bacteria. And also you should check wash before touching the udder. The hand must be washed thoroughly by the disinfectant or soaps, so that no infections is propagating from the hand. It's very important to clear the hands. The milkers should clean their hands very much, and it should be clean the cow dung from the farm, because cow dung is a special agent which infectious disease, the coliform bacteria is spread. So this type of treatment is depends on the situation, and the doctor should adjust it with the treatment procedure. But if some people there are available after calving, some of the cow don't give big milk from the fast calving, so they enter different types of things like feathers and other things in the teats, and it become septicemia. So in case of septicemia, the prognosis is very much bad. So that time, if it is septicemia happens, first of all you have to give the normal saline in the IV to reduce the at least 3 to 4 liter, to reduce the amount of toxins, and then cure it, and it will not, the udder will not the shape, remove the udder or sell it to the market. So this type of disease is very much harmful for dairy industry, and it destroys the udder. If the udder is destroyed, the whole procedure of milking will be destroyed. So don't rush to buy very expensive dairy cows. So first of all, you take some normal cows and keep these cows and with their calves, and then artificial insemination should be done in those cows, and you should develop those special breeds on your farm by first, second, third generation, and it will help to grow your economic status, and you will experience, then you will get success in this dairy farm business. So don't go for high quality cows in the tropical countries. You should first of all develop the breeds and cows by crossbreeding, by artificial insemination, and adjust the breed percentage of the blood of the cow with the environment of your country, and that's how you can get success in dairy farming. Thank you very much.